Hello, everybody. It's a beautiful day here at the baseball game. Just please give me a heads up if I'm going to get hit by a foul ball, okay? Just kidding. Okay, today let's talk about breast cancer. Breast cancer, it's a huge topic. There's a lot of content. There's a lot of content in your book, but we're just going to narrow down a few things that we really want to make sure you understand about breast cancer. Make sure you know, it is such an important topic. I'm sure every one of you knows somebody or a friend of a friend or a family member that has gone through some type of experience with breast cancer. Unfortunately, the rates of breast cancer are very, very high. 1 in 8 women of every woman will be diagnosed with breast cancer at some time in their life. And breast cancer is a leading cause of cancer-related deaths in women. Okay, so it's a really important topic. As a woman gets older, her risk for breast cancer does increase. We'll go over some of the other risk factors in a minute. But talking about prevention, trying to decrease these risk factors that we'll talk about is key. Chemotherapy prevention, some women who have a high familial history of breast cancer sometimes will have surgical removal of the breast tissue, have a mastectomy done prior to even being diagnosed with breast cancer just to prevent hopefully it from occurring. So there is that type of surgery. There's also chemotherapy prevention. And then identifying when you have breast cancer, so decreasing those risk factors. Self-breast exams, we'll talk about in a minute too, is a key part of screening and diagnosis, along with mammograms, needle biopsies or aspirations, and then making sure you're aware of how many community resources there are out there related to breast cancer. Reach for Recovery and the American Cancer Society are two major resources that you should at some time look at that. If you know anybody who's going through any type of breast cancer, make sure they're aware of those resources. They do have great resources and community outreach programs available. When we talk about mammograms, so some of the screening and diagnosis, the guidelines have changed over time. Some of it is insurance related driven. Unfortunately, they drive a lot of practice. So the screening, a lot of times, depending if you don't have any risk factors, a lot of times the screening times have increased between mammograms and things like that, depending on your insurance. But typically what the guidelines state is that you should get a baseline mammogram between the ages of 35 to 40 years old, and then every 1 to 2 years in their 40s, and then every 1 year after 50 years old of age. So that's kind of an average guideline. If we find tumors, if we find anything, typically a tumor that's less than 4 centimeters is usually curable. So that's always a good sign if it's a smaller type of tumor. When we talk about kind of breaking down some of the risk factors, so I said, your risk does increase with age, so that's definitely a huge risk factor. But previous history of breast cancer, family history of breast cancer, especially immediate family members like mothers and sisters, things like that, really increase your risk. Early menarche, so reaching menarche less than 12 years of age, and also late menopause, so greater than 55 years old would be late menopause. So the more, and what those kind of talk about is the increased exposure to estrogen. When a woman reaches menarche, she's exposed to more estrogen, and then the longer they go along before they reach menopause, they have all that more time with the exposure to estrogen. So those increase the risk factors for breast cancer. Nulliparity, or never being pregnant, not breastfeeding is also a risk factor. So it's good to encourage breastfeeding, not just because it's great for the baby, but it also decreases breast cancer risk. They believe that pregnancy and lactation interrupt ovulation for a period of time, which it does, and that this hormone alteration really decreases that breast cancer risk. Obesity after menopause and a sedentary lifestyle also will increase your risk factors. So we want to make sure those women are, maintaining a healthy weight, staying active, and things like that for multiple reasons. Caucasians are actually at highest risk for breast cancer. Alcohol use, low vitamin D stores. This plays a role in controlling normal breast cell growth, okay, and may be able to stop breast cancer cells from growing if you have more vitamin D levels. There's mixed research on birth control use. Again, there's all sorts of different types of birth control methods, but the ones that have the increased amounts of estrogen are going to increase those risk factors for breast cancer. Some of the screening and diagnoses. Screening self-breast exams is something that we've taught women how to do for ages. Teaching them to examine their breasts monthly, usually 5 to 7 days after menstruation. And we're looking for different changes in that breast. And it's a little bit easier to feel and find during that 5 to 7 days after menstruation due to the tissue changes in the breast. We recommend that they do it in the shower. It makes it a little bit easier. And they start at the areola. They're making a circular motion around the nipple out around the breast into the axilla in a circular motion. And they're using multiple depths of palpation in order to find any nodules or tumors within that breast tissue. Now, there is mixed research that the American Cancer Society came out with stating that research does not show a clear benefit for women to do self-breast exams. They stated that women detect 90% of lumps in the breast. However, only 20 to 25% of those lumps end up being malignant. Now, to me, that's a high percentage that if 20% of those lumps are malignant, and if that woman would not have done that breast self-exam, she wouldn't, may not have been diagnosed. And early detection is going to be a key factor for a better outcome when it comes to breast cancer. We still do recommend women do it, but we need to make sure they understand that it's not necessarily a clear benefit. I have a feeling it has a lot to do with insurance company driven research, because if a woman finds a lump, then something needs to get done to biopsy that or remove it. So some type of surgical intervention needs to occur, which costs money, and the insurance companies probably don't want to pay for it. So it's really truly unfortunate that insurance companies can drive that. So when they are doing that self-breast exam, though, whether it's the woman or the healthcare provider in the office, and they still do recommend definitely that the healthcare providers do it, they're looking at or feeling for a hard lump that's not movable. That would be our biggest concern. What else? When you talk about diagnosing, so doing the mammograms as part of the screening, if something is detected on a mammogram or a self-breast exam, if they find it in a self-breast exam, they're going to do a mammogram to look and see what they find. If they see something within that mammogram, typically what they will do is some type of needle aspiration of that nodule that they find, and that can confirm the diagnosis. So I'd make sure you understand that. So a needle aspiration can confirm a breast cancer diagnosis. And then they are going to do a biopsy of that. If we do confirm that that is breast cancer, they're going to biopsy that, take that, section of that tumor out, and send it to the lab. And what they're looking for when they look at this tissue is the type of tumor that's within there. So is it malignant? Is it benign? But if you were to ever be diagnosed with some type of breast cancer, the best type of tumor to be found is called an estrogen positive tumor. I'd make sure you know that. So estrogen positive tumors have the highest survival rate when it comes to these breast cancer tumors. So these respond much better to treatment. And when we say it's an estrogen positive tumor, it just means that cancer cells grow in response to estrogen. So some medications like tamoxifen is a common one that they can give to help combat these type of cells, these tumors, because it attaches to the cancer cells so that the patient's estrogen cannot attach to it and continue to grow. So the other thing I did talk about, so early detection obviously has an increased prognosis for survival. Estrogen positive tumors have a better prognosis for survival. But what type of management are we going to do? So once we've screened, once we've confirmed diagnosis, we've biopsied, what are we going to do about it? There's medical management and there's surgical management, and sometimes it's one or the other, sometimes it's both combined. So some of the medical management listed in your PowerPoint: radiation, adjuvant hormone therapy. So it just means that they're doing hormone therapy with something else. So it could be a lot of times after surgery, things like that. Biologic targeted therapy, which stimulates the immune system to help combat this. Chemotherapy is part of medical management. And then there's your surgical management. So there's different types of lumpectomies and mastectomies. So just by saying a mastectomy, there's different types. Make sure you understand the types of them. So a lumpectomy is just removing the actual lump, the tumor that they found. A total simple mastectomy, they're not taking all of the lymph nodes, okay, when they do that. A modified radical mastectomy, most of the lymph nodes have been taken, but they're not taking that pectoralis muscle. So there's no muscle tissue taken with that. And then there's a radical mastectomy. So radical mastectomy means they've pretty much taken everything. So they've taken the entire breast tissue, they've taken all of the lymph nodes, they've also taken some of that pectoralis muscle below that breast tissue to make sure that that cancer has not invaded that muscle tissue to spread. And then after that, after those mastectomies, comes some type of breast reconstruction. Typically, most patients will opt for to help reconstruct that breast, which is a time-consuming effort with that, unfortunately. With your mastectomy, so knowing if they took the lymph nodes or not is important to note. There are nursing considerations when it comes to that. So if you had a patient who had a left mastectomy, we need to make sure if they took the lymph nodes that we are not doing any blood draws on that affected side, so not on the left side. We're not doing blood pressures on that affected side because you have a risk of secondary lymphedema in that extremity, in that affected extremity, if we do those type of things. Okay. So that's pretty much it with the breast cancer. I know it's a huge topic, but that's the basics of what we really want to make sure you understand and you know. Please, look at some of those resources, the Reach for Recovery and the American Cancer Society, and look and see what type of topics and content they have in relation to breast cancer, because I'm sure you're going to see it, a great deal in your nursing career. Hopefully not, in anybody close that you know, but unfortunately, because it is such a high cancer rate, chances are you're probably, if you don't already, eventually are going to know somebody with breast cancer. So the better you can help them, the better. So that's about it. So I hope everybody has a good evening. Take care, and I'm going to go find the hot dog guy with the hot dog and the popcorn. Have a good one.